The number is right there on your insurance card. $500, $2,000, $3,000. You've seen it 100 times. You know what it's called? A deductible. And you think you know what it means. You pay that number, then insurance takes over and handles the rest. That is not what it means. Not even close. And the gap between what you think your deductible does and what it actually does cost the average American family $2,400 last year before their insurance paid a single dollar of anything. Most people believe the deductible is the most they'll pay before insurance covers the rest. It is not the most. It is the least. The deductible is the amount you pay completely out of your own pocket. Dollar for dollar, 100 cents on every dollar, before your insurance will consider covering anything at all. According to the Kaiser Family Foundation's 2024 Employer Health Benefits Survey, the average deductible for single coverage on an employer plan was $1,787. For a family plan, over $3,600. That is the amount you owe before your insurer spends a single dollar on your behalf. And it resets every year, January 1st, whether you're ready or not. By the end of this video, you will know exactly what your deductible does and what it doesn't protect you from. You will know why January is statistically the most expensive month in American healthcare. You will know about Marcus, a man who was offered 2 dates for the same surgery, 15 days apart, and why the date he chose cost him $20,147 more than it needed to. And you will know the 3 planning moves most families never make that change what the deductible costs without changing your insurance plan at all. Here is what the deductible actually does in practice. You go to a doctor, you get a bill, your insurer processes the claim. And if you haven't met your deductible yet, your insurer pays nothing. You pay the full negotiated rate, every dollar of it, until you've reached the deductible threshold. Most people go through open enrollment. That's the annual window, usually in October and November, where you pick your health plan for the following year. And they look at the deductible number and nod. $1,500. Fine. If something big happens, I pay $1,500 and then I'm covered. That is not what happens next. After you meet the deductible, coinsurance kicks in. Coinsurance is your percentage share of every bill, even after the deductible is met. Typically 20 to 30% of every covered service. You meet your $1,787 deductible. You assume you're done paying. Then a $5,000 procedure arrives and generates another $1,000 bill. Your 20% share, due immediately. The deductible was not the ceiling. It was the entrance fee to a building where you still pay for everything inside. This is what happened to a project manager from Cincinnati. We'll call him Marcus. In late November, Marcus was diagnosed with a hernia that needed repair. His surgeon's office offered 2 scheduling slots, December 28th or January 12th. Marcus chose January. The holidays were expensive. January felt quieter. It was the most expensive scheduling decision he ever made. Here is what Marcus didn't know. He had already paid $200 toward his $1,500 deductible in the back half of the year. On December 28th, he would have owed $300 to finish his deductible, then 20% coinsurance on the remaining covered charges. His total out-of-pocket for the December surgery, approximately $400. On January 1st, his deductible reset to $0. On January 12th, Marcus owed the full $1,500 deductible, again, from scratch, plus 20% coinsurance on top of that. His total out-of-pocket for the exact same surgery, $2,847. Same surgeon, same hospital, same incision, 15 days apart, $2,147 difference. From one calendar decision he didn't know mattered. Your deductible is not a protection mechanism. It is a delay mechanism, designed to keep you paying out of pocket long enough that you start to question whether the doctor's visit was really necessary. Think of it like a toll road that resets to $0 every January 1st. It doesn't matter how much you paid last December. You start from scratch at midnight, and the road doesn't care what you spent to get here. Marcus didn't know the deductible had a calendar built into it. Most people don't. So now you know what the deductible actually is. It's the floor, not the ceiling. It resets annually on a date the insurance company chose. And it can turn a December procedure into a January financial event without you changing a single thing about your care. But there's a number underneath the deductible that most people never look at. It is the actual worst-case scenario for your wallet in any given year. And it is not the deductible. The number you actually need to know is your out-of-pocket maximum. Your out-of-pocket maximum, sometimes called the out-of-pocket limit, is the absolute ceiling on what you can be required to pay in a single plan year for covered in-network services. After you hit that number, your insurance covers 100% for the rest of the year. According to the Kaiser Family Foundation, the average out-of-pocket maximum for single coverage in 2024 was $8,950. For family coverage, $16,100, not $1,787, not $3,600, $8,050 for one person. Before the insurance company is required to cover everything. Your deductible is the first wall. Your coinsurance is the ongoing toll between the first and second wall. Your out-of-pocket maximum is the second wall. And most people don't know it exists until they're already against it. Now here is the structural truth behind all three numbers. According to KFF's longitudinal survey data, deductibles for employer-sponsored insurance have increased by more than 60% over the past decade. Wages over the same period rose roughly 27%. The deductible was not always this size. It was made this size, deliberately, structurally, over time, as a mechanism for shifting the financial risk of healthcare from insurers onto patients. Every dollar added to your deductible is a dollar that used to sit in the insurer's claims budget and now sits in your personal liability. The premium you pay every month funds the insurance company's operations. The deductible funds the first $1,787, or $3,600 or more, of your own care. You are paying twice before they pay once. And here is what makes the architecture of this particularly sharp. The Federal Reserve's most recent report on the economic well-being of U.S. households found that 4 in 10 Americans say they could not cover an unexpected $400 expense without borrowing money or selling something. The average individual deductible is $1,187. The system is structured so that the amount patients must pay before receiving insurance benefits is more than 4 times what most Americans can absorb without financial distress. That is not a coincidence. That is the product. Here is what Marcus knows now, and here is what you can do with what you've learned in this video. First, find your out-of-pocket maximum, not just your deductible. Pull out your summary of benefits and coverage. That is the standardized document your insurer is required by law to provide you each plan year. Look for 2 numbers, your deductible and your out-of-pocket maximum. Write them both down. Most people know one. Almost nobody knows both. Second, treat the 4th quarter of every year as your medical planning window. If you've met a significant portion of your deductible by October or November, any non-emergency procedure, specialist visit, or scheduled surgery you've been putting off becomes dramatically cheaper before December 31st than it will be after January 1st. That is the move Marcus didn't know to make. It is now the move you know to make. Third, if your employer offers an HSA, a health savings account, contribute to it. An HSA is a tax-free savings account specifically designed for people on high-deductible health plans. Your contributions go in pre-tax, grow tax-free, and come out tax-free when used for qualified medical expenses. The contribution limit for an individual in 2024 was $450. Every dollar you put in reduces your taxable income and covers your deductible when it hits. It is the only account in the American tax code that is triple tax advantaged. Most people on high-deductible plans don't use it. You now know why that is a mistake. The number on your card was never the full story. It was the opening line of a much longer contract, written by the insurer, reset on their schedule, and designed so that the less you understand it, the more it costs you. Marcus paid $2,147 more than he needed to for a hernia repair, not because he made a medical mistake, because he made a calendar mistake inside a system nobody explained to him. You've seen the calendar now. That changes what January costs you. Right now, before you close this tab, open your benefits portal or pull out your summary of benefits and coverage. Find your deductible. Find your out-of-pocket maximum. Write both numbers down somewhere you'll actually see them. The CMS link in the description tells you exactly where to find that document if you've never looked at it. If you know someone with a medical procedure scheduled in the next 90 days, a surgery, a specialist visit, anything they've been putting off, send them this video first. It might save them what it cost Marcus. That's not an exaggeration. It's a calendar. Drop in the comments. When did you first realize what your deductible actually meant in practice? Was it a bill? A moment at the checkout desk? A conversation with someone who explained it after the fact? Tell me. I read every comment. Your story is the next person's warning. Next week on Body of Debt, you go to urgent care with a sprained ankle. The bill is $180. Your friend goes to the ER with the exact same injury. Their bill is $3,200. Same ankle, same diagnosis, same outcome. We're covering exactly where that $3,020 difference goes and how to make sure you're always walking through the right door. Subscribe so you're there when that video goes up.